So with a secondary breast cancer diagnosis, is there a specific diet that I should be following?
So no, there's nothing specific that we would necessarily recommend that you have to follow with secondary breast cancer. The same recommendations apply throughout. So if you are struggling with your eating a bit, then we relax recommendations. But if you are eating well, then getting that balanced, healthy diet is certainly what we would say to go for.
That's great. There are some days, obviously, when you're not feeling your best, and eating kind of goes out the window a bit, and you probably have things that you maybe shouldn't have quite so much of, but knowing that we've got the flexibility to do that makes it a bit more doable.
When you are feeling good, making sure making those mindful choices on what you're eating, and on those days when you're not doing quite so well, then being flexible and allowing yourself to have those foods that you would like to.
So as a secondary breast cancer patient, are there specific foods that I should be looking at incorporating into what I'm eating?
So I wouldn't say there's necessarily any specific foods. It does also depend on how things are from an eating perspective. So if you are eating well, your appetite's really good, then we would recommend going for a balanced diet. So by that I mean having a good portion of protein and carbohydrate in your diet, and then maxing that out using things like fruits and vegetables, for example. However, if you are struggling with your eating a bit more, your appetite's not so good, then we do relax that a little bit, and thinking more along adding some extra snacks or treats into your diet can be a really good way to boost up your eating. I think what's really important is there's no one size fits all approach here, and that goes the same with there aren't any singular foods that we'd say you definitely have to eat, but then equally there aren't ones that we say you absolutely can't eat. So it's finding what works for you as an individual.
Great, so it's kind of anything in moderation really.
Absolutely, but being flexible with that depending on how you're feeling or how your appetite is. But yeah, moderation is always a good place to start from, and then move off as is kind of necessary for you.
Okay, I find difficulty because of inflammation factors, because of chemo, that I need to look at what foods I'm eating to keep that inflammation to a minimum. Are there any specific things that we can do to make that better?
Yeah, so in anti-inflammatory diet is quite an interesting area. It isn't one that we have specific guidance and recommendations for at the moment. There are some foods that do have anti-inflammatory properties, and those can be included in your diet if there's something that you enjoy and you like, but there is no pressure to absolutely do that. For example, one might be something like turmeric, which some people do find quite helpful, but adding that into your diet is definitely better than using it in a supplement form, so that would be a really important point to take forwards. But I think the most important thing is it's something that you find, if you find it beneficial, then perhaps continue, but if you don't, and certainly if you don't enjoy taking it, then the negatives are going to outweigh the benefits at that time.
Brilliant. For those who are supporting, say, for example, myself or somebody else who's got a breast cancer diagnosis, when you're going through a difficult time for eating, how can they encourage and promote good eating for their loved one who they're trying to support?
It can be really difficult, and I think family members or friends, the kind of carers, can find it a really difficult time as well. We often kind of show quite a lot of emotion and support through food, and that shouldn't necessarily stop. I think it's making, sitting down with that individual and asking them what the difficulties are. What are the barriers to eating? Is it they don't fancy it, or they want something different? And then seeing what options. It can be really frustrating because people can say, I really fancy this meal, and then when it comes to it, they suddenly don't. And it's trying to be flexible and kind of working with the individual. Ready meals can be a really good option because it's likely to be a time where you're both very busy, and so actually leaning on something that's a bit easier and more convenient is absolutely fine to do. Accepting support from friends as well. People are often desperate to make some food or popping it in the freezer, so you've got that easy go-to. Changing the meal patterns and finding that time that works best for you. It may be that breakfast needs to be shifted a little bit later or a bit earlier, and thinking what might work a bit better at that time.
So can they also, as a supporter, contact agencies like Breast Cancer Now to get information from people like you who can advise them of the sort of things that they could do at the time rather than feeling that they're on their own?
Absolutely, and I think that's another great thing, is looking to that where else they can get support. And the support isn't just for the individual, the patient. Carers can access that support all the time, and they can ask, and we've got some hints and tips and some tips and tricks that they can try, certainly do so. I'd always encourage them to reach out and ask, or go onto websites and see if there's anything additional that they could try.
Brilliant.
If you have any questions or concerns about diet or breast cancer, or you're considering making major changes to your diet, then we would recommend contacting your GP or treatment team.
You can also contact us at Breast Cancer Now, and you can do that by contacting the nurses via the helpline or through our Ask Our Nurse service.